So I'm Tony Roberts. I'm the lead physical therapist here at Vibra Hospital in Thornton, Colorado. And I want to talk to you a little bit about the neurological services that we provide in our therapy department for the patients here.
And I'm Mark. I'm actually going to be asking Tony a couple of questions here. So Tony, what types of neurological diagnoses do we treat here at Vibra Hospital?
The neurological diagnoses that we see there's a large range of neurological disabilities that we see or diagnoses that we see. They can range from traumatic in nature, such as what you might see in a car accident resulting in a traumatic brain injury, all the way to more of a degenerative disorder such as Alzheimer's or ALS or MS, which tend to be progressive in nature. And the goals around those different types of diagnoses change depending on the patient's personal circumstances and difficulties surrounding that diagnosis.
Okay, that's wonderful. What is the goal of therapy with neurology patients?
Again, so after we do our initial assessment and establish a plan of care with a combination of occupational, speech, and physical therapy, we then define some goals that have been discussed with the patient and or their families. And we progress the plan of care accordingly based on the patient's tolerance, their ability to, how fast they're progressing, their ability to adapt to what we're asking them to do, with the ultimate goal being reaching smaller milestones in the early part of their care, eventually to get them to the highest and safest level of function that we can achieve, with the main objective is to provide a discharge home if that's possible. Once they would return home, they would be paired with an appropriate home health agency if they were in need of continued therapy services after discharge.
And that is one way that Vibra Hospital, along with being accredited by the Joint Commission or certified with the Joint Commission, that's kind of, would you feel that's how we continue our continuum of care? Would you think that would be a fair statement?
Absolutely, and it's something that is, the home health care piece after discharge is actually something that's initiated early on in the process. We're thinking about where this patient may end up in their stay here and what that might look like. So we're continually working with case management, the doctors, nurses, all the other disciplines involved in their care, and constantly changing where we're headed with that patient in terms of providing them what's appropriate at the time. And then when they discharge home, there's a pretty good idea of what their needs may be when they get there.
Perfect. Well, Tony, thank you very much. That actually was very informative and everything. So thank you folks for watching, and we will see you next month. Thanks, Tony.
Thank you.